Bismillahirrahmanirrahim. The thought of the day is nothing will work unless you do. Assalamu alaikum. My name is Dr. Inshrah Khan and I am a PGR of Community Medicine and Public Health at King Edward Medical University, Lahore. Today, the topic of my presentation is Health Sector Reforms, Public-Private Partnership. And I will be presenting this topic under the kind supervision of Professor Dr. Saira Aksir. Our learning outcomes will be health sector reforms, public-private partnerships, structure, importance, types and models of public-private partnerships, public-private partnerships in healthcare system, public-private partnerships in Pakistan healthcare system and its examples, recent updates and then MCQs. Learning objectives. At the end of this presentation, the participants will be able to define public-private partnerships, illustrate its structure, relate to its importance, appreciate its types and models, recognize its value in healthcare system. Health sector reforms. Health sector reforms involve changes aimed at improving the efficiency, accessibility, and quality of healthcare systems. These reforms can include various strategies such as policy and governance change, funding, financial management, service delivery improvements, human resources, public-private partnerships. Public-private partnerships. A public-private partnership is a collaboration between government and private sector entities to deliver public services or infrastructure with a clear allocation of risks between the parties. Public-private partnership is used where service quality is poor or ability to pay is low. Main principles of public-private partnerships. Public-private partnership is based on two main principles. Both parties invest in the project in a financial sense, manpower, material, budget, and in an expertise-related sense, knowledge and network. The parties contribute to a societal and often also commercial purpose. Structure of public-private partnerships. Public sector defines project goals. Private sector handles design, construction, and operation. Public-private partnership contract specifies terms and conditions. Project entity, a joint venture or consortium formed to manage the project. Funding sources includes contributions from both public funds and private investments, and oversight and regulation ensures compliance with project standards and regulatory requirements. This is a diagram that represents public-private partnership. We can see this is the project company. There is involvement of the government, sponsors and shareholders, experts, financiers, escrow agents, and customer or government. 7 essential conditions that define public-private partnerships. Arrangement between the public and private sector or parties. Risk sharing optimally between contracting parties. Supply and provision of services for public benefit by private partner. Standards that focus on quality of service or performance. Investments in and or management of public assets by private partners. Payments linked to performance and time period for a specific duration. Importance of public-private partnerships. Public-private partnerships are important because they enhance efficiency, increase investment, improve service quality, expand access, share risk. These are some other benefits of public-private partnerships. For example, these benefits include fill service gaps, use strengths of both sectors, avoid duplication of services, establish norms for service for both sectors, involve communities, enhance political clout, bring new resources by user charge and cost saving and risk sharing. Risks include less powerful partner may feel loss of control or loss of identity, blame each other in failure, require extra efforts by managers, political risks, conflict of interest, may lead to corruption, may lead to worsening of efficiency, quality, and higher costs if not properly managed. Ethical, methodological, accountability, sustainability issues in transnational partnerships. Types of public-private partnerships. Civil works and service contracts, management, operation and maintenance contracts, concessions, joint ventures or government shareholding in project company, and privatization. Civil work and service contracts, agreements where private firms are hired to construct infrastructure or provide specific services, typically involving building and maintenance tasks. Management, operation, and maintenance contracts are the contracts where a private entity manages and operates a public facility or service, including ongoing maintenance, often for a fixed term. Concessions, agreements granting private companies the right to operate and profit from a public asset or service for a defined period, often including investments and revenue sharing. Joint ventures or government shareholding in project company. Partnerships where the government holds equity in a private company or project, sharing both risks and rewards in a collaborative venture. And then privatization, the process of transferring ownership or control of public assets or services to private entities, aiming to increase efficiency and reduce government involvement. Models of public-private partnership. Public-private partnership models can be classified in two ways, based on the roles of both parties, and then based on the degree of risk sharing and private sector participation. Based on the roles of both parties, we can see when there is financing by public sector and service provision by private sector. This type of public-private partnerships are contract, social insurance programs, and social marketing. When there is financing by the private sector and service provision by the public sector, these models include user fees, autonomous hospitals, drug donations, and vaccine development. Now, based on the degree of risk sharing and private sector participation, here on the x-axis, as we move towards right, there is increased degree of private sector participation, and on y-axis, as we move upwards, there is increased degree of risk taking. The different models are build model, build maintain model, design build operate model, lease develop operate model, build operate lease transfer model, build own operate transfer, build own operate buy build operate. This is another diagram. As we move in this direction, there is more authority to the public partner, and the different designs are design and build, design build maintain, design build operate. Similarly, if we move in this direction, there is increased authority to the private sector, and the models are design, build, maintain, operate, build, own, operate, transfer, build, own, operate. This is another diagram that shows some other models of public-private partnerships. Now, what is design build model? This is a model where a private entity is contracted to both design and construct a public infrastructure project, often with a focus on efficiency, cost effectiveness, and streamlined project delivery. Design, build, finance, and operate. This is a model where a private entity handles the design, construction, financing, and long-term operation of a public infrastructure project with the aim of delivering the project efficiently and managing it over its life cycle under a single contract. Build, lease, operate, and transfer model. A public-private partnership model where a private entity builds a facility, leases it to the government or another entity for a specified period, operates it during the lease term, and then transfers ownership back to the public sector at the end of the lease. Build, own, operate model. A public-private partnership model where a private entity builds, owns, and operates a facility or service, retaining ownership and revenue rights for the duration of the project's life. Build, own, operate, and transfer model is a model where a private entity is responsible for the design, construction, financing of a public infrastructure project, operates the facility for a specified period to recover its investment, and then transfers ownership back to the public sector at the end of the agreement. Buy, build, operate model. A private entity purchases an existing asset, builds additional infrastructure or upgrades, and operates the facility or service, often involving a long-term management and revenue arrangement. Operation and maintenance contracts are public-private partnership arrangements where a private entity is responsible for the ongoing operation and maintenance of public infrastructure or services, typically including daily management and upkeep tasks. Operation license is a private sector partner, is a model where the private sector partner is granted a license or other expression of legal permissions to operate a public service, usually for a specified term. This model is often used in IT projects. Finance only. This is a private sector partner, usually a financial service company, that funds the infrastructure component and charges the public sector partner interest for the use of its funds. Public-private partnership in healthcare system. Public-private partnerships in healthcare involves cooperation between government agencies and private organizations to improve delivery and management of healthcare services. We will consider now some models and their examples. For example, in hospital management, the model is private company manage and operate public hospitals or clinics. Example, hospitals are managed by private firms under public-private partnership agreements aiming to improve efficiency and service quality. Infrastructure development. Private sector builds and finances healthcare facilities. Examples include construction of new hospitals or clinics funded and built by private entities but operated with public oversight. Service delivery. Private organization provides specific health services or specialized care. Example is private entity may run diagnostic centers or offer specialized treatments under public sector contracts. Training and capacity building. Private sector partners in training healthcare professionals or upgrading their skills. Examples include partners with private organizations to provide training programs for medical staff. Essence of public-private partnership: finances versus delivery, and then public versus private. When there is public financing and public delivery, these are public hospitals. With public financing and private delivery, these are contracting demand or supply side fence. When there is private financing and public delivery, these are international diseases, TB or HIV control initiatives. When there is private financing and private delivery, these are private hospitals. Public-private partnerships in Pakistan healthcare system, its history, transition, current status, and future directions. Pakistan has increasingly adopted public-private partnerships to enhance infrastructure and services. Key sectors include healthcare, transportation, and energy. Example, in healthcare, public-private partnerships in managing and operating hospitals such as the Punjab Intermediate Cities Improvement Investment Program. History. Public-private partnerships in the healthcare sector in Pakistan began to take shape in the late 1990s and early 2000s. Early efforts focused on exploring ways to involve private entities in managing and improving healthcare facilities and services. Some initial projects included private management of specific healthcare services or facilities to improve efficiency and quality. Transition. During 2000 to 2005, the government began formalizing its approach to healthcare public-private partnerships. The focus was on establishing frameworks to encourage private sector involvement while maintaining public oversight. In 2005, there was introduction of the National Public-Private Partnership Policy. In 2010, there was creation of the Public-Private Partnership Authority (PPPA). In 2012, the Public-Private Partnership Act was enacted, providing a legal framework for public-private partnerships. This act helped in formalizing and regulating public-private partnership projects, including healthcare-related initiatives. During late 2010s and early 2020s, healthcare focus, public-private partnerships in healthcare began to diversify with an emphasis on improving infrastructure and service delivery. Private entities were involved in managing hospitals, clinics, and diagnostic centers. Notable projects during this period, examples include Punjab Intermediate Cities Improvement Investment Program, which involved private sector participation in healthcare service management and infrastructure development. On July 7, 2020, the President issued the Public-Private Partnership Authority Amendment Ordinance 2020, that is also known as 2020 Ordinance, amending the Federal Public-Private Partnership Act to create a more facilitative public-private partnership regulatory framework. This is the 2020 Ordinance. Current status. Ongoing projects involve the development of new healthcare facilities, expansion of existing services, and collaboration for specialized care. Future directions, strategic goal. The future of healthcare public-private partnerships in Pakistan will likely focus on enhancing service quality, expanding access, and leveraging private sector innovation and investment. there is growing emphasis on sustainable development, integrating advanced technologies and addressing healthcare disparities through effective public-private collaboration. Here are some examples of public-private partnership programs in Pakistan healthcare sector. These include Punjab Intermediate Cities Improvement Investment Program, Sehat Sahulat Program, National Programs for Malaria, Tuberculosis and HIV or AIDS Control, Lahore Waste Management Company Healthcare Initiatives, Public Health Programs with Private Sector Collaboration, Public Sector Mother and Child Hospital, Health and Nutrition Development Society, Mobile Doctors Program, Khyber Pakhtunkhwa Health Sector Reforms Program, and Pakistan Red Crescent Society projects. Public-private partnerships in Punjab. Punjab announced in July 2020 that several new public-private partnerships would be initiated, including a clean drinking water project in the capital city Lahore, a vehicle fitness testing system project, and zero waste management recovery project. Recent updates. Public-private partnership as a tool for sustainable development, what literature says. This article was published in 2020. Public-private partnership has been proposed by the United Nations as a tool for sustainable development goals. This research fills the perceived gap by reviewing sustainability-oriented public-private partnership studies to better understand the relationship between public-private partnership and sustainable development. The increasing popularity of sustainability-oriented public-private partnership studies is to a degree associated with policies of the key global players in public-private partnership. Research gaps and future research trends are suggested. This research contributes to the body of knowledge of sustainability-oriented public-private partnership and can help researchers and practitioners in better understanding the status, gaps, and direction of future efforts regarding sustainability-oriented public-private partnerships. Collective Insights of Public-Private Partnership Impacts and Sustainability Equality Analysis. This article was published in 2021, and it says the global coronavirus or COVID-19 pandemic exposed the weakness of the healthcare systems, including laboratory systems, and is a call to action for unprecedented collaboration and partnerships to deal with the global crisis. An important vehicle utilized within the global public health context is the public-private partnership model, whereby multiple international organizations forge unified project charters to collectively reach mutually agreed goals. The purpose of this research is to holistically examine perceptions of public-private partnership model sustainability related to inputs and impacts among a collective network of stakeholders experienced with President's Emergency Plan for AIDS Relief Workforce Development, Laboratory System, Strengthening Project Implementation. Interviews were conducted with frontline stakeholders from public and private sector organizations based in the United States and select President's Emergency Plan for AIDS Relief supported priority countries. Analysis revealed three dominant themes: public-private partnership impacts, keys of successful collaboration, and logistical challenges and opportunities to enhance sustainability of public-private partnership outcomes in the future. Public-private partnerships in primary healthcare, a scoping review. The Astana Declaration on Primary Healthcare reiterated that primary healthcare is a cornerstone of sustainable health system for universal health coverage and health-related sustainable development goals. It called for governments to give high priority to primary healthcare in partnership with their public and private sector organizations and other stakeholders. Results showed that most public-private partnership projects were conducted to increase access and to facilitate the provision of prevention and treatment services. That is tuberculosis, education and health promotion, malaria and HIV or AIDS services for certain target groups. Most projects reported challenges of providing primary healthcare via public-private partnerships in the starting and implementation phases. The reported challenges and the recommendations on how to overcome them related to education, management, human resources, financial resources, information, and technology system aspects. Risk severity metrics for sustainable public-private partnership projects in developing countries. The concept of a public-private partnership is not new for developing countries, although many initiatives are being contemplated for potential implementation. This paper evaluates the crucial success factor for the effective execution of public-private partnership projects, and it also investigates the appropriate distribution of the risk involved in public-private partnership projects. It is concluded that inflation, revenue risk from end users, foreign exchange fluctuation, political situation, law and order, and corruption are the major risks in developing countries for better management of public-private partnership projects. Most of the public-private partnership projects are public-oriented. The society of any city is directly affected by most public-private partnership projects. This paper presents the identified key risks of public-private partnership projects in developing countries, which are mostly financial and public-oriented. Recent countries' political and economic circumstances and sustainability have transformed public-private partnership ventures into a successful way to support the governments to develop roads, energy and facilities through private partners' financial and technological capacities. Moving forward to the MCQs. A new public library project is underway and local government has defined the goals for the library, including its size and services. A private company has been hired for it. This is a public-private partnership program. What role does the private sector play? A. Define project goals. B. Specifies terms and conditions. C. Handles design, construction and operation. D. Oversees regulatory compliance, or E. Forms the project entity. The correct answer is C. Handles design, construction and operation. A regional health project is being managed by a joint venture formed between several private companies and a government agency. All the conditions are discussed and made clear before this joint venture, except A. Risk sharing between both parties. B. Supply and provision of services. C. Quality of service. D. Clear allocation of responsibilities, or E. Specified time duration.
D.
Yes, the
D.
correct answer is D. A local government is exploring the use of public-private partnership to address various challenges in its public healthcare system. Which of the following is not a key benefit of utilizing public-private partnerships in this context? A. Enhance efficiency. B. Increase investment. C. Improve service quality. D. Expand access. Or E. Eliminate government oversight.
E.
Yes, the correct answer is E. Eliminate government oversight. A public health system needs significant financial resources to build a new hospital. They decide to enter into a public-private partnership to secure the necessary funds from private investors. Which benefit of public-private partnership is primarily addressed by this approach? A. Enhanced efficiency. B. Increased investment. C. Improved service quality. D. Expand access. Or E. Risk share.
B.
Increase investment.
Yes, the correct answer is B. Increased investment. A government is considering transferring the control of its public hospitals to private entities to improve efficiency and reduce the direct involvement of government in daily operations. What process is being described? A. Privatization. B. Civil work and service contracts. D. Design, build, finance, operate. D. Management, operation and maintenance contract. Or E. Build, own, operate, transfer.
A.
Yes, the correct answer is A. Privatization. A private company is contracted to build a new power plant, and it will retain ownership and operate the plant for its entire operational life. The government has no intention of taking ownership after the project's completion. Which public-private partnership model does this scenario present? A. Build, own, operate, transfer. B. Build, lease, operate, transfer. C. Design, build, finance, operate. D. Build, operate, transfer. Or E. Build, own, operate. The correct answer is E. Build, own, operate. A private entity purchases an outdated sports facility upgrades it by adding new infrastructure, and then operates the facility while managing the associated services and revenue for a long-term period. Which public-private partnership model best describes this scenario? A. Build, own, operate, transfer. B. Buy, build, operate. C. Build, lease, operate, transfer. D. Design, build, finance, operate. E. Build, operate, transfer. The correct answer is B. Buy, build, operate. A public health system partners with a private organization to offer training programs for its medical staff to enhance their skills and knowledge. What type of public-private partnership model is this? A. Service delivery. B. Infrastructure development. C. Training and capacity building. D. Hospital management. E. Build, operate, transfer. The correct answer is C. Training and capacity building. In 2005, a significant policy was introduced to guide the involvement of private entities in public projects, including healthcare. What was the name of this policy? A. The National Public-Private Partnership Policy. B. The PPP Act. C. The Healthcare Public-Private Partnership Framework. D. The Public Sector Investment Program. Or E. The Private Sector Development Plan. Correct answer is A, the National Public-Private Partnership Policy. During the late 2010s and early 2020s, public-private partnerships in healthcare began focusing on various aspects, including infrastructure and service delivery. Which project exemplifies this trend by involving private sector participation in both service management and infrastructure development? A, the National Public-Private Partnership Policy. B, the PPP Act. C, Public-Private Partnership Authority. D, the Punjab Intermediate Cities Improvement Investment Program. Or E, the Healthcare Management and Improvement Program.
D.
Yes, the correct answer is D, the Punjab Intermediate Cities Improvement Investment Program. This is the answer key to all MCQs. This is the link to our YouTube channel. Kindly like and subscribe. And thank you for your attention.